Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 17-year-old man presents with a 2-week history of abdominal pain, diarrhea, and repeated episodes of flushing. Examination reveals urticarial skin lesion on their trunk. What test is most likely to reveal the diagnosis? A. Chest X-ray. B. Urinary catecholamines. C. Serum amylase. D. Urinary 5-HIAA. E. Urinary histamine. Here we have a 17-year-old man with a 2-week history of abdominal pain, diarrhea, and repeated episodes of flushing. On examination, we can see urticarial skin lesions on his trunk. The diagnosis here is systemic mastocytosis. The diagnosis is a systemic mastocytosis, and the best choice for evaluating systemic mastocytosis is urinary histamine. Here we are going to explain it. Explanation: urinary histamine is used to diagnose systemic mastocytosis. Given the history of diarrhea and flushing, a diagnosis of carcinoid syndrome should be considered, which would be investigated with urinary 5-HIAA or 5-hydroxyindole acetic acid levels. This would not, however, explain the urticarial skin lesions. The patient on examination had urticarial skin lesions on his chest. In a young person, a diagnosis of systemic mastocytosis should be considered. Another factor against carcinoid syndrome is the age of the patient. The average age for a patient with carcinoid tumor is 61 years. Okay, systemic mastocytosis. Systemic mastocytosis is a rare disorder characterized by abnormal proliferation and accumulation of mast cells in multiple organs and including the skin. As you know, mast cells are immune cells involved in allergic and inflammatory reactions, releasing histamine, prostaglandins, and other mediators. In systemic mastocytosis, these cells infiltrate organs such as bone marrow, liver, spleen, gastrointestinal tract, and lymph nodes, leading to both mediator-related symptoms and organ dysfunction, for example, hepatomegaly, splenomegaly, and so on. In conclusion, systemic mastocytosis results from a neoplastic proliferation of mast cells. Features of systemic mastocytosis: Urticaria pigmentosa produces a wheal on rubbing, which we call it Darier's sign. Flushing, abdominal pain, monocytosis on the blood film. Here we can see a Darier's sign in solitary mastocytosis or mastocytoma. Mastocytosis has different types, and here we can see Darier's sign in solitary mastocytoma. What is Darier's sign? Darier's sign: gentle rubbing or stroking of lesion leads to local itching, erythema, and wheal formation. As we can see here, we can see also in this patient. Leads to local itching, erythema, and wheal formation within 2 to 5 minutes, and the cause is histamine release due to histamine release. We can see Darier's sign in different patients like cutaneous mastocytosis, juvenile xanthogranuloma, leukemia cutis, histiocytosis X, and lymphoma. We can see also a pseudo Darier sign in smooth muscle hamartoma. The diagnosis is usually with raised serum tryptase levels and urinary histamine. As we said, the diagnosis for our patient is urinary histamine. Here was a short explanation about the systemic mastocytosis. thank you for your attention.